Hello everyone, my name is Eric and I'm a dental hygienist here at Children's Dental Services, and today I'll be chatting about teeth. Let's get into it. So here are our objectives. If you're curious, take a quick pause, otherwise I'm going to continue. I have a lot of chat about. So babies and their oral health. So big question I typically get, when should I go in? When should I bring my kid in? The answer is when they have their first tooth. That is the latest I want your kid to come in. That way we can start looking at your kid's teeth, gums, and everything to making sure everything is developing normal. A lot of times parents are told 3, and to me, that is often too late. I already start seeing cavities, and so to prevent that, I want you in as soon as they get that tooth. Something we often see or can see is bottle decay. The #1 disease in children is actually tooth decay, and to prevent this, we want to avoid the kid going to the bed with the bottle. Having the kids eat a lot when they're developing, as you know, as a parent, but just going to bed with the bottle, as we'll see here, this kiddo, this often happens, kids sleeping with the bottle, but what happens there, if they have their teeth, now that pooling of sugar and then milk is just going around their teeth, and the bacteria just constantly are doing their thing, and that's already started seeing some discoloration, maybe some pain. So something to help with this, if the kid really likes that bottle with them, replacing it with water inside that bottle, or bare minimum when they fall asleep, get a rag that's wet, a little warm, and just wipe their teeth. Get that extra sugar off their teeth. They'll decrease the chances of them getting a cavity. The best thing is, the last thing I want in their mouth is water. Signs of happy, healthy teeth are gums that are firm, pink. We want a lack of redness. And for us people with a little more melanin, we might have experienced a little bit of darker gingiva. Sometimes we see pink, sometimes we see like a darker brown. Those things are all within normal limits. It's just that redness is when I'm kind of starting seeing signs of gingivitis and irritation. Things that we should also not have is bleeding when we're flossing or when we're brushing, as well as a lack of a bad odor in our mouth, a lot of saliva in our mouth, or an adequate amount. There shouldn't be like, oh, I really need a lot of water. The easiest way to help with some oral dryness is just some more water. So what is plaque? Plaque is that kind of white stuff that is on our teeth. We can call it the metropolis for bacteria, or sugar bugs, as I like to say for kiddos. This is a place where bacteria like to congregate. And you can typically, even when you forget to brush for a day and you look at your teeth like, oh, something kind of, it feels a little bit different. My teeth feel different. Or I can look in the mirror and I see some whiteness around it. That's plaque. It's soft. It can be brushed off with our toothbrush, no problem. There are many, many, many different types of bacteria. As you can see, there's about 700 types in the oral cavity at any given time and between different people. The biggest contender on giving us cavities is Streptococcus mutans. It's a type of bacteria that when left to its own devices will cause those cavities. So what is a cavity? Basically, it's a hole in our tooth caused by bacteria due to acid exposure. So what can we do? What foods are great for our teeth? Broccoli is a great thing for our teeth. Hard, sharp cheddar cheeses are great for our teeth. Basically anything natural, unsweetened, unprocessed, those really whole foods, natural things are really good for our teeth, as well as for our diet, our stomachs, our bodies. Some little advice there. You can see just brushing before we, in the morning, typically I eat my breakfast and then I brush my teeth. So the sugar, I get a little more fluoride into my mouth and kind of reset the sugar exposure I just got. And some more pictures, some great things is legumes, beans. I try to have beans every day myself. They're really good for our diet, for our stomachs, as well as for our teeth. They're high in fiber, protein, all that jazz. Nuts are really good. They're really, they're a lot of good healthy fats. They're also a nice harder substance. They help clean our teeth off. And leafy greens, a lot of fiber, lots of vitamins, great things for our teeth. Things that are like not bad, but not good. Well, they're both good, but they're just like watch outs specifically for our teeth. Great for our stomachs and growing and development, but just watch out for our teeth. So fruits are really good. They're really delicious. but they have a lot of sugar in them. Breads, wheats, oats, have a lot of sugar in them as well, not complex sugars. So they're really good in the sense that they take a while for them to be broken down. They're not immediate, like a big exposure like sweets are. So all great things, but just some things that are kind of in the middle ground specifically because of the amount of sugar and what's their primary component. Some things that are bad though for our teeth are sodas, chips, sugars, adult beverages for us, older parents that are older than 21. And we talk about fermentable carbohydrates. It's kind of that big word you may see. And that's in all those processed things that we have, as well as those other things like I was saying, there's healthy like fruits and bread. But what's worse is these quick sugars, these orange juices. Often I can see kids walking around with an orange juice box, and that 8 ounces has almost 3 oranges in it. I definitely need like 1 or 2 oranges, but after the third one, I'm done. And I see kids take down multiple of those juice boxes. So that's a lot of sugar for our kids. Some other things that we have to watch out for is energy drinks for our teens and for us adults. Some juices, again, eat. What I like to say is enjoy your fruit, but eat them, don't drink them. Some things that parents don't realize are bad for our teeth or not the best are raisins and fruit snacks. They're heavily targeted towards kids, but our teeth are very groovy, lots of movement, and those can get stuck right on there. And kids sometimes don't even notice that they're there, and they'll just sit there and the sugar will keep doing its thing. And it's all about frequency, and we'll be talking about that in a second. And frequency or exposure. A quick recap about what pH. Our pH scales goes from 0 to 14. The lower the number, the more acidic. The higher the number, the less acidic. When we eat sugar, you can kind of see from this cute little diagram down here, the bacteria eat the sugar, they create an acid. So our mouth goes from around a 7 to a under 5.5 is kind of the threshold. We go into this realm over here. Our teeth start weakening and go from that happy, healthy state to that little grumpy face there. And that's when we start seeing that. And exposure specifically, I mean, is we eat a sugar. Let's say I have lunch, a normal, happy, healthy lunch. But even with that lunch, I'm going to eat some sugars, some natural sugars, but I'll eat them. And for 20 minutes, we started to be seeing exposure and our teeth started getting a little more weaker. And that's fine, because then slowly over time, our saliva has enzymes to bring our pH back to that nice, good 7. That's where we can start seeing remineralization. And but the thing is, if we keep having juice, we are kind of constantly staying in this realm, in that under 5.5 area, and not able to come back to that 7. And that's when we're starting seeing chances of increasing probability of getting cavities, because that sugar, the teeth aren't able to reset. They're not able to reharden. They're just constantly getting a little bit weaker. Something that I suggest to my patients that like chewing gum, switch your gum, definitely no sugared gum, switch to any sugar alcohol, but specifically my favorite is xylitol, because research shows if you can chew it 3 to 5 times or 5 or more times a day, you'll greatly decrease your chances of getting cavities. And for this age, I'll go minimum 5. I start suggesting it for my patients who are in like the middle school age range, if not high school age, and all adults as well. The last thing with xylitol, just keep it away from your pets. And kids, don't let them swallow it as well. Quick over brushing, you probably already heard this. Let's go quickly over this. Brushing 2 minutes, bare minimum, pea-sized amount. It's more about how long you're brushing and then the amount of toothpaste and how forceful you're going. A little toothpaste will go a long ways, and going for longer multiple strokes and circular motions is going to do a lot of benefit for your kids' teeth as well as your own. How often to change the toothbrush? We're looking for about every 3 to 4 months. Electric toothbrushes are good, but the manual one works just as well. Research kind of goes back and forth of which one's better. I personally use an electric toothbrush, but I have a backup one, a manual whenever I travel or whenever I go to my parents' house or something like that. I just use a manual. Both work. The nice thing about an electric one, it has a timer function. That is all I have to chat with you about today. There's a lot of information in 10 minutes. If you have any questions, I'll probably be perusing the comment section a little bit. Otherwise, hit up your local dentist that you go to. If not, if you don't have a local dentist, we do have our phone number right down here with Children's Dental Services. We're always taking in new patients. We see all forms of insurance. Here are just some of our locations. We go all over Minnesota. thank you again so much. My name's Eric Colon, and I was with Children's Dental Services. And thank you so much for listening. Have a lovely day, and keep smiling.